The purposes and benefits of a Kerlix-Coban dressing is to prevent the development of edema, provide a minimal level of compression to a lower limb, and protect the skin of the lower limb. We often use it also to secure dressings between treatments. Maintaining neutral warmth is especially important for people with arterial insufficiency. If a patient is in bed, position them comfortably in supine and elevate the bed to avoid poor body mechanics. Inform them that you will need them to hold their leg above the bed a few inches while you are applying the layers of the dressings. If they cannot do so, request help from another staff member. Alternately, position the patient in sitting. Gather the Kerlix and Coban rolls. 2 rolls of Kerlix and 1 of Coban are usually sufficient. More may be necessary depending on the size of the leg you are treating. Position the patient's ankle at 90 degrees and maintain that position for the entire dressing application. Start the non-elastic gauze roll at the base of the toes on an angle in line with the metatarsal heads. Make sure you can see both the top and bottom of the foot. Apply the Kerlix firmly, rolling it off of the roll as shown, and overlap each layer by 50%. Proceed toward the heel, always in the same direction. Skip the heel, and with the next turn, cover the heel space you skipped, which I obviously just missed in the video. Proceed up the leg, always with a 50% overlap. Avoid creating wrinkles in the gauze roll, and stop just short of the knee crease. Because you are using a roll that is non-elastic, it is acceptable to start the successive rolls anywhere along the course of the leg, rather than starting at the bottom, as we would always do with elastic type material. With the Coban, the technique is the same. Coban material should not come in contact with the skin. Place a modest amount of stretch in that material, no more than 50% of the total possible stretch. At the top of the calf, if there is excess, do not proceed back down the leg, but rather cut the Coban at that point. Inspect the dressing, making sure it is acceptable and that the patient is comfortable with it. If they have sensation, they may feel a very mild amount of compression, especially when they pump their ankles or ambulate. That mild amount of pressure will assist the venous system in returning flow toward the heart.